cannabis.com. Coming up on BOC Live, we connect with Dr. Evan Lewis. He is the director of the Neurology Centre of Toronto. He is an epileptologist and assistant professor at University of Toronto and the chief medical advisor of JMCC Group. We want to connect with him as part of Lift & Co. to talk about the important work he is doing, especially as it relates to pediatric epilepsy. Spend a lot of this time talking to weed industry people, which we like a lot. We talk brands, we talk cultivation, we talk retail, we talk all those things, and then we get to talk about important things with you. It is true. Talk about what you're doing as it relates to cannabis, because it is groundbreaking and why I think the industry is where it is today because of the work that you do.
Okay, thanks.
So it's why we're allowed to do it.
Why we're allowed to do it. Yeah, and listen, I mean, it takes everybody involved to get to me, right, and for me to be able to do the things that I'm doing as well. So I'm a pediatric epileptologist, so it's a fancy word for an epilepsy specialist in neurology. And I work with epilepsy patients, both adults and kids. Also work with patients with concussion, headache, and a variety of other neurological disorders or indications. And the main work, though, that I'm working in the epilepsy, because that's my area of specialty, is to really figure out treatments beyond just CBD. CBD is pretty well known as an effective treatment in terms of the randomized control trials that have been done and whatnot. So it's more about exploring other areas of cannabis too, because we do know from parents, patients, and from some research that has been developed that the other molecules in cannabis work as well. So that's where things have moved, I guess, in the last few years for me, because I started off with using just CBD alone, but now progressing forward.
And thinking about that, when you move beyond CBD, or started CBD but then moved beyond CBD, or CBD and, not hunches, that's not how doctors work, but like, what are you trying to find? Like, what are the key challenges you're trying to address?
So, epilepsy is so complex. It's so complex, and parents don't come to you and tell you that they tried this medication and their kid's seizures stopped because it didn't happen. Right? It's very different from pain. It's very different from subjective things like anxiety and depression and other conditions where there's a massive subjective component. With epilepsy and seizures, I always tell people it's an on and off phenomenon. You're either having seizures or you're not having seizures. So if you're having seizures and then you take this medication and seizures stop, like, that's very high signal, and it should be explored. So, while I was working with CBD and just CBD alone and was really cautious about using THC, parents were coming to me and saying, listen, the CBD alone is not working. I actually have my kids on this product and their seizures have stopped. So you got to listen to that, right? So that's where I came from. And then, using the research that was out there that was already established, a lot coming from Israel initially, but then we had some good Canadian uncontrolled data that at least had helped as a guide. I could then extend into THC a little bit more and feel comfortable doing that, and could extend into using that in other conditions, and then even other molecules with kind of exactly the same story.
And is it, in your experience doing this, are patients, parents, and other medical professionals, are they more open to it now?
Certainly more open to it. In time that's happened. And it's been fascinating. Like I always say to people, being involved in cannabis, psychedelics are in medicine right now, it's more than the medicine. It's not like other areas of medicine where you're classically trained and you're working in it and it's very siloed in academics. This is like you're on a socio-political, cultural front, and it intervene, but it honestly makes the day-to-day job really interesting.
Because you don't necessarily know where your patients or their parents are coming from in that area. But I imagine they are all seeking similar things. They're seeking relief.
They are. And I always say this to other people too. And the doctors on the flip side of that are seeking to help these people. But you have two massive different worldviews colliding, birthed out of the stigma from, that we all grew up in. And this is where it becomes really interesting. So it's not just the treatment of the patient at its core, you're also treating this massive, big socio-political, cultural...
It's a lot of things to push uphill.
It is. But it honestly does bring an interesting element to my day-to-day, because it gives me the opportunity to provide a ton of education, and I can teach a lot to other people. And if I remain open and I keep that view, I feel that I can be an effective teacher on both sides of that coin.
Yeah.
Yeah.
And I want to get into that because partly is about educating patients and their parents, but also other doctors in your field here and elsewhere. What has been their response to the work that you're doing, or not your mission, but your mission?
I think I'm fortunate of the background that I have. That I'm uber specialized, right?
There's a lot of things you started off with the work that you do. It's like a lot of long words altogether narrows the field.
Exactly, yeah. And versus, unfortunately for other physicians who may not have the degree of expertise, when they're coming forward and saying, hey, I can treat kids with epilepsy, it's like, well, how much epilepsy training do you have? Now, I think that's okay. I mean, with good team support from someone like me or someone else, you need the comprehensive plan. But it's helped me in, I think, achieving some buy-in from other doctors, because I can stand up there and say, hey, I'm an expert in my field in epilepsy and pediatric epilepsy. Yeah. I've got the training, I worked at sick kids, I have the background, I have a center where we do a lot of this stuff, and so that helps. So that's to my advantage, but I'm aware of that as well. So I don't try to take advantage of that. I try to use it in a constructive way to ultimately help patients. And I think that's got the buy-in from other specialists. And if I can get even just like one other specialist buy-in,
that's a lot.
It becomes it becomes an exponential effect.
Well, you're doing really obviously important work, exciting work, and you're doing it really well. And you're importantly, I think, good at talking about it.
Okay.
Because there's some people that would be doing interesting work and not be able to sort of express it to the outside world. You're very good at that too. Right. You spoke at an event we did, I want to say 100 years ago, but I'm pretty sure it was 2019.
2019?
I think it was 2017. Yeah, it was a very long time.
You got to remember, there's a COVID factor in
yes,
here.
That's true.
Yeah. You multiply everything by 1.4.
I think it was 2001. No, I'm just kidding. But it is. I think important to continue the conversation, obviously to continue the work that you're doing, because it's super important. And I thank you for making time, whenever that was, but also for today.
Sure.
Great.
Jay, thanks so much. I always appreciate talking to you.
Be well. That was Dr. Evan Lewis of the Neurology Centre of Toronto. If you like this program, please rate and review us on Apple Podcasts, Spotify, or wherever you heard the show. It helps support the work we do. We're able to do what we do because of ongoing partnerships with Alterna Savings, Cannabis at Work, Cannabis Benchmarks, Can Delta, Gallagher, Headset, and Torque & Mains. Find out all that we do at businessofcannabis.com.